Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst. So today I have Farideh with me, and I'm going to let her introduce herself, and then we're going to go ahead and talk in general about what we can do to help men be rock stars in the bedroom.
Hey guys, my name is Farideh Golombieski. I'm a nurse practitioner at RevitalyzeMD. I've been in nursing for over 10 years, and my goal is to make you feel better. That's it, all around. So we're going to talk about ways we can do that for you guys.
The ways we can help. So many different issues pop up, right?
Well, hopefully.
Yeah.
That's the goal.
No pun intended there, right? That is the goal of treatment. So, but it can be, again, erectile changes. It can just be them in general. Experiencing different things such as low long brain fog, low libido.
Lack of confidence, poor sleep, low drive, not just sex drive, but drive in life. I have guys say, my confidence, I don't know what's happened. It's just not what it used to be.
That's right.
It can be lots of different things.
Testosterone is a life force for men. And so, again, when it starts to drop, they start to notice that confidence is a huge change, and just that competitive edge, right? Because
Absolutely.
Men compete, and that drives them. I
just got to note, the guys in the room all kind of giggled a little bit at that.
That's what they do. They compete. That's right. And so when it starts to drop at all, we might notice some changes, and not that I'm gearing that towards anyone specifically in the room either. But anyhow, so basically, not only can erectile changes happen, but, just the fact that you can actually even get erections and maybe lose them. You're not confident you're going to get them every time. Maybe you drink, maybe you've been out, late, and you're noticing that it's not consistent every time.
Exactly. We have guys that are come into the clinic for that reason, or just because they don't want to worry. They want to enhance what they do have. They want to be confident that it's going to work every time, regardless if they've had a drink, regardless of what's going on, or what the stress in their life is, or what's happening. So we get both ends of the spectrum, those that are having those erectile change differences, and then those that are just looking to enhance their performance.
That's the thing. It's a badge of honor. If you have anything you want to improve, then be proactive and go after it and get improvement in it. So if it's consistency, if it's better erection, sometimes they'll actually, even look into it and think that size might improve with a P-shot, for instance. And so if that's something that you want to try, that's not something we actually promote, because again, I think if you're not having a completely strong erection, then when we get that back for you, then size will appear bigger. But maybe or maybe not, does it really help? But we'll have young men that just want performance enhancement and, better, control over when they have orgasms. So it's not a premature, ejaculation. So it's not all just erectile changes. It can be, again, orgasmic strength, the drive, controlling your timing of orgasm. So there's lots of things that go into it.
Absolutely. So that's what we're here to talk about, is the different ways we can help with that. So our clinic, we do a wide variety of men's health and sexual wellness. So we do the P-shot, which Dr. Durst kind of hit on a little bit. We do stuff with the Gainswave, which is acoustic shock wave to help repair blood vessels. The P-shot is where we take your blood and spin it down and take that platelet-rich plasma and re-inject to help those growth factors talk and repair as well. We also do testosterone replacement, so that can be
hormone optimization.
Absolutely. Yeah. And I love that she said hormone optimization, because it's not just testosterone, but that is the main hormone you all have. But there are other ways that we can support that through supplementation as well as medication.
And then, so there's other things such as peptides and IV therapy, and, even, the little blue pill and a special formulation for that, that we do in our clinic through a local pharmacy. So there's lots of different things that make it a comprehensive treatment plan. So if we were to talk about let's talk about Gainswave first, actually, because I think we probably get a lot of men that end up coming to us because they have been online And I think Gainswave is doing a fabulous job of educating men on erectile changes, in that there are solutions that can happen with that. So let's talk about Gainswave first.
And like you said, they do a great job of advertising, whether it's sports talk radio locally, they're talking about it a lot on there, or a lot of times men are coming in going, so I've read about Gainswave, that's what I'm interested in, let's do it. And I'm like, well, let's talk about what exactly is happening. What are the areas that we're hoping to improve to see if Gainswave is the right option? So Gainswave uses that acoustic shock wave to help repair the blood vessels, to help increase blood flow to the penis. So a lot of times it is a blood flow issue, not a hormonal issue. So it can be hormonal, that's about 20%, but the majority of it is blood flow, which is 80% of the reason why we have issues getting erections. So Gainswave helps with that blood flow.
And Gainswave is fabulous at repairing the blood vessels. So again, like Farideh said, it's acoustic shock wave. So we're doing it in over the penis, and then in what we call the perineum, or the scrotal
everything
area.
But the scrotum, guys.
Everything but the scrotum specifically.
That thing's sensitive. We're not
doing
going to mess with it.
the entire area. Yeah, but the scrotum would be painful, so we don't do it there. Otherwise, it is not painful. It takes about 20 minutes, 20, 30 minutes, not painful, doesn't require any numbing medicine, and basically we're using acoustic shock wave over the penis, and again, everywhere but the scrotum, to get those large blood vessels. And we're trying to communicate with the large blood vessels and the endothelium to repair the endothelium and basically improve the health of the blood vessels, so we can get increased blood flow to the penis.
Which might make it look a little bit bigger.
Yeah, a little bit bigger. And again, think about it. A marvel of science, the penis. It increases blood flow in a matter of seconds by 40 to 50 times. And so
congratulations, guys.
Congratulations. You are a marvel of
You're
science.
A beast.
A beast, completely. And so basically that's the goal, is to bring out beast mode even more and increase the blood flow. And then we want to tourniquet it in the penis. So again, when we're doing acoustic shock wave to the penis, we're hitting the corpus cavernosum, the smooth muscle there, the collagen elastin, fibrous, lining that's going to basically hold blood flow in the penis. And so that gets you an erection and then you can keep your erection. So venous leak is one of the things that can happen. And really what happens is the corpus cavernosum gets all the blood in there, but then it starts to leak out of the small veins. So if we can make that corpus cavernosum lining and smooth muscle healthier, compresses the veins, and then you get a prolonged and very firm erection, which is the end goal.
That's it. That, along with the P-shot. The P-shot helps with that. It helps repair those vessels. So she said venous leakage. That's just fancy for erectile dysfunction. You're losing the blood. You're losing your erection. That's all that is, guys.
It is.
It's nothing crazy or terrible. It sounds way scary, but it's what you're experiencing.
And, I think that if we're breaking it down into different, like the blood vessels and getting blood flow in, we want to keep it in and not let it leak out other ways. So no matter what, it's getting a healthier blood flow, healthier blood vessels to keep your erection firm and longer. So that's the end result. But basically, P-shot augments the Gainswave. And so there's very few times that we actually recommend one and not the other, because
unless you're on maintenance or something like that. Sometimes guys will come in after they've completed treatment and just get another P-shot, a year out, because they said, it helps with sensitivity. I just want a little bit of that extra edge back. So, but typically we are doing them together because they do complement each other so well.
And you don't do them every time so we're not doing them every time together. But what happens typically, again, you're going to come in to the office, and really what's important is opening those conversations with, an office that you trust, that has comprehensive services. So we can do a medical history, get a very thorough screening of all your medical problems, if any. High blood pressure medicines might cause some issues with erectile changes. So will, any antidepressants, anti-anxiety medicines. And then we want to also do a scoring system. So we're doing what's called a SHIM score, an international, erectile function scoring system. So we can get an objective number about where you are. And again, where we want to take you, what the end goal is.
Yep. And depending on where you fall on that scale determines what treatments we use and how many treatments we need to use and how many different angles we need to attack the problem with. Again, typically, with Gainswave, whether it is 6 treatments or 12 treatments or 24 or whatever it may be that you need, how many P shots we're going to add in there with the PRP will be determined by that scoring. Also, any other things that we'll add in, such as any peptides or IV therapy or any extra supplementations that we might need to add to help as well. So there's lots of different angles that we can go at. But typically with the Gainswave, we do add the P shot in, but it is not every treatment. It kind of gets little sprinkled in there.
Yes. It's usually a ratio of like Gainswave to P shots, and definitely the Gainswave are more frequent and 20 or 30 minutes in the office and not painful. And the P shot is not painful either, but we are drawing your blood. We're spinning it down to get the platelet-rich plasma. Platelets have growth factors in it. So just like our arm gets cut and platelets go to the area, stop the bleeding, and you get a bunch of healing and you grow arm tissue back. We want to communicate with the stem cells in the penis to get healthier endothelium, blood vessels, nerves, collagen, elastin, and harder erection. So it's more what I consider a local treatment. So because we're injecting the PRP or growth factors into the penis. So we definitely do pair Gainswave with P shot the day we do a P shot. But you're getting many more Gainswave than you are P shots overall. So usually we're talking about 1, maybe 2 P shots where you're doing a whole series of Gainswave. But we do a Gainswave prior to the P shot that day because, again, we love to use that acoustic shock wave to tell the tissue it's injured and then dump a bunch of growth factors in there with the PRP so that you get enhanced repair and regeneration. So they work fabulous together to get you the end result, which is
improved erections,
and better
stronger
orgasmic,
orgasmic strength, increased sensitivity, all of those things.
All the things. You don't have to have those changes persist. There are things and solutions we can do now so that you don't, if you notice any changes, and we have a lot of men that come very early on, again, like we said, just because of inconsistency. Circumstances will make it, maybe not as consistent an erection, and that's bothersome enough. But, there's loss of, and then it's progressive, again, so over time, 40% of men at 40, 50 at 50, 60% at 60 will have some kind of erectile changes and some low, testosterone that needs to be treated.
And it's really important to be proactive. So the guys that are coming in with, let's say, better scoring, right? They're having some inconsistencies and they're wanting to improve that. Those are the guys that we don't need to do as much with because there's not as much improvement that needs to be done. So the longer you put it off, the longer you make excuses, the longer you go, oh, well, maybe it was that glass of whiskey, or, oh, I'm stressed at work, or, oh, whatever the reason may be, stop and check yourself. Because the longer you allow this to progress, the harder it's going to be to get function back. The more we're going to have to do to get that blood flow, the more we're going to have to do for repair. So the longer you put it off, the more treatments you're going to need. So be proactive, pick up the phone, make your phone calls, whether it is with our clinic or another clinic if you're in another state, but be proactive. The longer you wait, the harder it is to get that full function back. Yeah. We'll get it back, it's just going to take a while.
Yeah, it just depends on how many sessions of Gainswave or a P shot you need. And again, the lower your scoring system is, the more improvement that we need to see. And again, don't think because you're 30 and you have or 35 and you have, a night or two here and there and aren't able to maintain your erection, that's just situational, because it happens in the 30s. And so the earlier we can hit that, the better. Again, for, like Farideh said, for improvement. So it's time to, be proactive, take the bull by the horns and do procedures and, and seek conversations with people that can actually provide solutions for, what you're experiencing. And so speaking of that, it's not just P-Shot and it's not just Gainswave. We're going to mention a few other things that we can kind of pair with it because, again, we love to approach it in a more comprehensive manner. So a lot of offices, Gainswave has become very popular, right? And, if you look on the internet and you look at Gainswave, people are very happy with the Gainswave results. You're going to see a lot of positive feedback from patients, but you'll also see some offices that are kind of putting Gainswave machines in and maybe not even doing Gainswave it's not a machine, it's a protocol. So, but they might be doing an acoustic shock wave in the office, maybe not even be trained to officially do Gainswave or the Gainswave protocol. Or just throwing a machine in the office to do acoustic shockwave. Maybe it's not quite the, approved machines that we use with the Gainswave protocol, or that they're comprehensive in it, So again, for the best results, you want to pair it with other things. So a couple other things that we consider or do. Well, hormones is definitely one of them.
Well, like we said, 20% hormones. So hormones for guys, typically we are talking about testosterone replacement, but sometimes it is just hitting the pathway early on with supplementation as well. So there are, when we're looking at where testosterone comes from and what that looks like and following that pathway down, there are other things such as pregnenolone and DHEA that are very important in the production of testosterone. So we need to look at, okay, well, what about supplementing some of those things as well as optimizing our hormones, because that does play a part.
And then even, again, testosterone will convert to other things and metabolize. And so DHT is one of them, estrogen is one of them, and then it'll bind to, a protein as well. And so then you have free and active. So looking at all those data points to actually optimize, your hormones. And again, even if that's earlier supplements, that we're basically hitting it however we need to optimize it for you individually. The other issue is that, a lot of men want to maintain fertility, and we are seeing this at a younger and younger age. So there are other ways to still hit and supplement and optimize testosterone, but to also stimulate your own testosterone production and maintain fertility with that. So you want to go to a hormone specialist. You want to go to an office that actually sees lots of hormone patients.
And isn't just checking total testosterone. That's important. So I'm going to repeat that. Are not just checking total testosterone, because that is not the whole picture. That is one piece of the picture. Free testosterone is really important. Like Dr. Durst said, there are proteins that bind to testosterone, and you won't see that necessarily in that total, but you'll see it in the free. So going to a place that is comprehensive, that is looking at all of your blood work and seeing exactly what's going on.
And so I would push to say, if you're looking for a hormone specialist, and we're talking about sexual wellness with men here, and again, hormone optimization is part of that. 20% of it is a hormone optimization, 80% blood flow. So if your hormones unoptimized, you're not going to get sustained results, even if you're doing the Gainswave and P-Shots. But look at the website, the office. So if you don't see a provider, with a background and, and credentials and you need to really think twice about going to that office, because, you need to be able to see who you're going to be seeing when you're there, right? And so I would definitely start with that if ever you're looking at hormone clinics, somebody that is experienced with it, a picture of who you might be seeing. If you saw Farideh's picture and you read her credentials, you would want to go see Farideh, but if there's no one that pops up on the website for you to see, then I would probably search a little bit more, because you can always find some offices that offer, hormones and the sexual wellness in combination. Again, we see patients remotely too. That's something that's an option as well. And we do have a lot of patients that travel from a distance because it's not offered everywhere. But a lot of data points, a lot of comprehensive treatment with the hormones. Peptides are another thing that we can add into your treatment for a comprehensive wellness or sexual wellness plan.
And one that we enjoy to use in our clinic is PT-141, which helps with orgasmic strength. So that is a fan favorite, right? Oh,
yeah.
Who doesn't want improved orgasms?
Yeah. And that one is like one that everyone loves, but when?
Exactly. Not everybody needs it. Again, comprehensive.
I think that everyone would, again, they love it once they try it, but it's a timing issue. So it may work in 30 minutes, it may work in 5 hours. And so you got to get timing for you. And then not only that, some people will have some nausea. So again, something that you need to just play with the dose and acclimate to. So, but it works differently than the PD5 inhibitors. And the PD5 inhibitors are more of a local treatment. And so those are the little blue pill, or the Viagra, Cialis, and those are working from an increased blood flow locally.
And again, so that can be Viagra, that can be Cialis, or it can be a combination of both, which is something a local pharmacy here does for us, which the men enjoy quite a bit. There's also, like she said, the peptides, but not everybody, needs it or necessarily, we have guys that'll come in and say, hey, I think I need testosterone. Well, no, maybe you don't need testosterone. Maybe there's something else you need, so we definitely want a very good history and get all those data points so that we can do a treatment plan that's right for you. So whether that is Gainswave in a P shot and in a peptide, or whether that's Gainswave in a P shot and hormones, or maybe it is hormones. Maybe it is not an erection issue, but we're tired but we're worried about fertility. So maybe it is not necessarily a testosterone replacement that we're doing. Maybe we're hitting it from a completely different angle.
And stimulating your own improvement of testosterone. Yeah, no, absolutely. And then likewise, we can do IV therapy too. And the IV therapy has some amino acids in there that are really good for blood flow, good for sex drive, increasing sperm count if that is an issue, and those work really well as a supplement, as an augment to everything else that we're doing. So that's another
little
option.
Booster, guys.
Little booster.
Just a little booster.
And then if you like cuddling, there's oxytocin that you can actually combine with, the PD5 inhibitors for nasal spray, troches, all kinds of different things. So again, there's so many options out there, and just knowing there's options out there, and that you don't have to, number one, suffer in silence, because a lot of people don't know where to have that conversation. You may not be having it with your buddies, because I find that usually is not the case.
Because we've learned that. If you've listened to our other podcasts, we've learned that you're not talking to your friends. So come and talk to me.
Friends. Yeah, exactly. Not talking to friends, not talking to family. But whoever's in the room knows for sure. And we're more than willing to talk about it. So come talk to us about it, and then we can help you decide what solutions are right for you. And again, it's all individualized, and it depends on what your needs are and where your baseline is and what you got going on.
There has recently, in the Journal of Sexual Medicine, there was an article talking about the P shot specifically and the effectiveness of it. So if you're looking for research or data on it, we finally have some really good backing and some data in a well-known medical journal about the benefits of the P shot. So I always like to throw that in when I can, because typically we don't have research articles on things that don't make big pharma money. Yes, so it's nice to have something that says, yes, here's a study that was done. It was done very well. These are our results. There was a statistical difference. It does work. And so that is out there as well.
That's a good point. I'm so glad you brought that up. I almost forgot. And that's the thing, since the P shot was, originated, with Dr. Reynolds, they've been trying to gather data so that they would have some support, because again, patients love it. The effects are phenomenal. And yet it's hard to study something that isn't supported by big pharma. And if you can't make money off of and blood products and blood concentrates, you can't. And also, anything identical to the body, such as hormones, you're not going to find a lot of studies. So if you're waiting for a lot of studies to support some of the regenerative services that we do, you're going to wait a little while. And so this,
it's hard to find.
It's hard to find only because the support is not there. It's regenerative. It's not a drug. It's not surgery. It's not traditional medicine.
Can't patent
and
it, guys, and make millions of billions of dollars off of it.
Yeah.
So.
And you got it. And Big Pharma will always protect the bottom line. And the patent. So that's a great, point, because I forgot about that one.
Yeah,
it's a recent
newer,
development.
Yeah, just in the last couple months. So that's exciting.
We'll put the link in the note so that you guys could at least link to that and then find out some more information for yourself. So if you guys have any questions, concerns, you have anything you want us to address in the future in another podcast, let us know in the comments. Like, subscribe, share with friends. Share with friends, because this is a good way to just share it with
Sharing is caring, guys.
Sharing is caring, and you don't have to talk to them about it. You can just share. Everybody has
Which we know isn't going to happen, right?
Everybody has a friend that wants to know, right?
That friend that talks about the little blue pill.
Yes.
Send them the link.
Yeah, send them the link. And let us know if you've had any experiences with P-shots or Gainswave or PT-141 or anything we've discussed. We would love to hear about it. So again, let us know, and we can cover more topics of interest to you in the future. So we're here to revitalize your look, your health, and your sex life. Thank you.